What does a high Ca19-9 mean for pancreatic cancer? Imagine your blood as a busy highway, carrying signals that tell doctors what's happening inside your body. One of those signals is called Ca19-9, a protein that can be measured through a blood test. In the context of pancreatic cancer, a high level of Ca19-9 often points to the presence of disease, but it's not a simple yes or no answer. It's more like a clue that helps doctors piece together the bigger picture. When Ca19-9 levels are elevated, it usually indicates that there is a larger or more active tumor, meaning the cancer might be more advanced. This is because the tumor cells produce this protein, so higher levels can reflect a bigger tumor burden. However, it's important to remember that not everyone with pancreatic cancer will have high Ca19-9 levels. Some people naturally produce less of this protein due to genetic differences, so a normal level doesn't completely rule out the disease. A high Ca19-9 can also be seen in other types of cancers, such as gallbladder, lung, or colon cancer. Plus, certain non-cancerous conditions like pancreatitis, gallstones, or liver cirrhosis can cause elevated levels too. That's why doctors don't rely solely on this blood test to diagnose pancreatic cancer. Instead, they use it alongside imaging tests like CT scans or MRIs and a thorough clinical evaluation. One of the main uses of Ca19-9 is to monitor how the disease responds to treatment. If levels go down after therapy, it often suggests that the treatment is working and the tumor is shrinking. Conversely, if levels rise during or after treatment, it might mean the cancer is growing or coming back. But again, this isn't a perfect test. Sometimes levels can fluctuate for reasons unrelated to cancer activity. Because Ca19-9 isn't sensitive enough to detect early small tumors, it's not recommended as a screening tool for people without symptoms. Its main role is in helping doctors track disease progression or recurrence in patients already diagnosed. Always remember, a high Ca19-9 is a piece of the puzzle, not the whole picture. It's essential to interpret this test in combination with other diagnostic tools and clinical findings. If you or someone you know has a high Ca19-9 level, it's important to consult with healthcare professionals who can interpret the results properly. They can guide you through the next steps, which might include further testing or treatment options. Every person's situation is unique, and medical decisions should always be personalized. So, while a high Ca19-9 can suggest active disease, it's just one part of the overall assessment needed to understand and manage pancreatic health.